There are two types of pharmaceutical suspensions. First, a diffusible suspension contains light powders which are insoluble but on shaking disperse evenly throughout the vehicle and allow an accurate dose to be poured. Secondly, indiffusible suspensions contain heavy powders which are insoluble in the vehicle and do not disperse evenly on shaking. In these preparations, the vehicle needs to be thickened, and this is achieved by the addition of a suspending agent. Here are some proprietary examples of pharmaceutical suspensions for internal use. Here are some proprietary examples of pharmaceutical suspensions for external use. When preparing a diffusible suspension, weigh all solid ingredients and check their solubility. Pre-measure any liquid ingredients using the smallest possible measure and pre-prepare any double-strength chloroform water required. Choose an appropriate container in which to dissolve any soluble solids. Calculate the quantity of vehicle required for dissolution and add approximately that amount. Note, in this case, all the double-strength chloroform water is required and also some extra potable water in order to dissolve the solid. Remember the basic principle of adding solute to solvent. Rinse the watch glass with more vehicle and add the rinsings to the beaker. Stir well to dissolve. Now we have all the soluble solids in solution. Transfer the diffusible powder to a porcelain mortar. Add a small quantity of the vehicle to the solid in the mortar. The vehicle may or may not be a solution of soluble ingredients. Mix using a pestle to form a smooth paste. Add further vehicle in small quantities. Continue mixing after each addition until the mixture is a pourable consistency. Transfer the contents of the mortar to a conical measure of suitable size. Rinse out the mortar with more vehicle and keep adding the rinsings to the measure. Use a spatula to scrape any solid down into the mortar and continue rinsing. Continue until all the solid has been transferred from the mortar. Add any liquid ingredients to the suspension. Remember, if you used a conical measure to measure any of the liquid ingredients, to rinse the measure out and to add the rinsings. Note, the syringe does not require rinsing as it is designed to deliver a measured quantity. Finally, make up to volume with the vehicle. Stir and transfer the suspension to an amber flat medical bottle with a child-resistant closure. Label on the curved side of the bottle and dispense to the patient. When making an indiffusible suspension, one of the solid ingredients will be the suspending agent, in this case tragacanth. As before, pre-measure any liquid ingredients. Transfer the powder of the smallest quantity into the mortar. Add approximately the same amount of the next powder to that already in the mortar. Mix lightly with the pestle. Continue adding the second powder in amounts that are approximately equal to that already in the mortar and mix with the pestle. Therefore, we are doubling the amount of powder in the mortar at each addition. Don't forget to scrape the powder down into the mortar for efficient mixing. Add a small quantity of the vehicle to the mortar and mix to make a pourable consistency. As before, the vehicle may or may not be a solution of soluble ingredients. In this case, an ingredient was used, syrup. Rinse out the measure with more vehicle and add rinsings to the mortar. Continue to dilute to make a pourable paste. Transfer the pourable paste into a suitable measure, and don't forget to rinse out the mortar with more vehicle. Ensure no paste is left behind in the mortar. Add any liquid ingredients. Make up to volume with more vehicle. Stir and transfer the suspension to an amber flat medical bottle with a child resistant closure. Label on the curved side of the bottle and dispense the product. Suspensions intended for external use are manufactured using the same principles as for diffusible or indiffusible internal suspensions, although they will be packaged in an amber ribbed medical bottle. Before being dispensed to the patient.